I think families can help their person to recover by becoming informed about the disorder, by seeking support for themselves so that they don't get overwhelmed. You know, it's the oxygen mask theory. You need to look after yourself first so that you can look after the person. And I think that they can also, knowing more about the disorder and knowing more about the treatments can make sure that they get the right treatment and that they're working with someone who will also be prepared to work with them. Often one of the barriers to treatment is that the person doesn't want to seek treatment, and that can be really frustrating for the families. So I think it's really important that families go out and get informed about the disorder. They can seek help themselves from organisations like Helping Minds and other carer organisations. They can do courses like the NEA BPD's Family Connections course, which is a 12-week psychoeducation course that studies have shown reduces their sense of burden and guilt, and you know it's a very hard gig for families because BPD is something where there's a lot of emotional dysregulation, there's a lot of anger. In the past, families have been blamed, and sometimes that's not fair. So, you know, if they can go out there and get informed about it, they can learn their own coping strategies, and, you know, through family connections, you know, they can change the way they interact with their person and, you know, at the least not make things worse and often help to make things better. Okay, so Family Connections was developed about a decade ago in the States, specifically for families because, you know, they recognised that there was this disorder that not many people knew a lot about, and yet when families did know more about it and were involved in supporting their person with BPD, the recovery outcomes were much greater. So it's a psychoeducation program. It teaches the same skills that someone going through dialectical behaviour therapy, which is one of the evidence-based treatments for BPD. It gives them the same skills, you know, things like validation, mindfulness, interpersonal effectiveness, so, you know, getting along with people better. We've been teaching it for a while now, and it's really moving to see people's relationships change. In Western Australia, carers' rights have been recognised, I think actually Australia-wide. And whilst you don't have any right to know what is said between a treating clinician and a client, you can actually share what's going on at home, and you know you do have the right to know if they're accessing treatment. And really, it's recognised now that the best recovery-based treatments involve family members.